The intensive care unit at Prince George's Hospital is now for coronavirus patients only. More than 50 people are currently getting treatment. The hospital's interim CEO, Dr. Joseph Wright.
What has been, fairly sobering is to observe how sick some of these patients are. And how quickly they can go downhill.
Most of the cases in Maryland have been in Prince George's County. At this hospital, the staffing is already at its max, and they've converted every room possible to handle those in need of extended care.
We're literally at the beginning of the surge. We still have we still have a ways to go.
Dr. Wright says they don't want to run out of resources too soon. They're now looking at other sites in the University of Maryland medical system to take the load off of Prince George's Hospital. A surge tent to handle extra patients is already being set up at Bowie Health Center. What was once Laurel Regional Hospital is reopening next week with 135 additional beds. Now, Dr. Wright says they need more equipment.
This disease keeps people on the ventilator for a long period of time. A week or two is not unusual.
The toughest problem to solve right now is getting extra manpower to take care of these additional patients and keep those currently on the front lines from burning out.
We have to provide relief for our people.
These hospitals obviously juggling a lot. On one side, they're managing the response to COVID-19, and on the other end, making sure they have the staffing and space to respond to other medical emergencies. I'm Lorenzo Hall, WUSA 9.